Hi everyone, we're here with our beautiful patient Amy. Thank you so much for allowing us to film this, Amy. So if you don't mind, just please tell me what you think you would like to see improve.
I think on the sides here, kind of the jowl area, I see that kind of like sagging down, and maybe here a little bit. I don't know if under my eyes look baggy.
Okay. First of all, you look incredible, you look great, but there are certain things we can do. We're going to use what we call the Juvederm family of products, which are my favorite. We're going to use fillers and we're going to do some Botox to make some improvements. And I agree with you, primarily the first thing I see is you're developing a little bit of jowls here. And unfortunately what happens over time with aging is that some of the fatty tissue that's suspending everything up starts shifting and it starts moving downward and it kind of collects due to gravity along the jawline. I want you to know that my philosophy when it comes to just doing anti-aging treatments is about less is more. My approach is just to be conservative. We do like what we call just some minor improvements, and we can always in subsequent visits, if necessary, we can actually do more. What we can do in Amy's case is I always start out, my algorithm is that I think applies to a majority of patients. It's about, if you notice, she's got a little bit of jowling. So we're gonna go ahead and put a little bit of filler in her upper cheek to lift this up. We're also gonna go ahead and put a little bit of filler in your laugh line and what we call this marionette line to build out your chin. With regards to your lower eyelid, you do have a little bit of bags that are forming, but when I actually inject your cheek, you will see your eyelid get a little better. But in terms of addressing the upper part of her face, we're going to do some Botox. If you raise your eyebrows, go ahead and bring them together, and then smile. You can see she has some frown lines, some forehead lines, as well as some crow's feet. Botox is ideal for that area. Botox relaxes the muscles, and as a result, the area gets smooth. Botox lasts typically for about 4 to 5 months. Fillers really last up to 2 years. And what I'm primarily doing is using filler called Voluma to build out her cheeks. We're going to use this cross-link filler called Juvederm Volure for her laugh line and for her chin area. So we're going to go ahead and get started. So this part of the technique is done with a cannula. Cannula is a very dull instrument that allows me to minimize bruising, and it allows me to be really accurate in terms of where the filler goes without causing bruising. You feel a little pinch, okay? Let me know if you need a break.
Yeah, definitely noticeable.
Noticeable,
Yeah.
right? You see how these are not as deep? And then your chin it had like some dimples in it. There was a hollowness here. That's all gone. And I bet you when we look at your before and after pictures, we're going to see an improvement in your angle here of your neck. But overall, just that heavy jowling is not as present.
Right, that's definitely
so much better.
Yeah.
And this is going to get better over the next 2 weeks. So just overall, we did one on each side here. We did another one on each side lower down. Then we did the 5th syringe here. And then we actually did 6 and 7. So it was 7 syringes. That is not a lot. You can see that with 7 syringes, she's significantly better. And then we'll reevaluate her in about 2 to 3 weeks. And if she desires, we can always do more. Ideally, I would love to like do her a little bit in her temples to smooth that out, and do a little bit in her mid cheek and jawline. I just want you to tell the audience what it felt like to you. Beyond what was it painful?
At the beginning, when you just feel like a sting when the needle goes in, and then it's kind of an odd sensation when you're doing the poking around, and it just kind of I don't know, it doesn't like hurt. It's not painful. It's just
Okay.
kind of awkward feeling of
Yeah, the cannula
poking.
definitely, exactly, because some patients say it feels like a worm crawling under your skin. It's kind of moving around.
Yeah.
It's not painful. It's a little odd sensation.
Right.
Patients always get a little numb because there is a little bit of lidocaine anesthetic inside the syringe. So do you feel numb at all?
Yes, I feel a little bit numb underneath the skin.
Yeah, that will go away in about an hour. So lastly, let's just do the Botox and then we'll be done. So Botox is going to feel like a little pinprick. You'll see the effect starting in about a day or two, and then you see the maximum effect in about a week, and it lasts for about 4 months. So bring your eyebrows together. Okay, and that's the Botox.
Okay.
Good. So that's a wrap. Thank you so much for watching.